In today's session, we'll discuss why hospitals aren't the place to treat premature ejaculation. In modern medicine, the occurrence of impotence, premature ejaculation, and other conditions in men is called sexual dysfunction. Sexual dysfunction is divided into two categories, functional and organic. A functional state is one in which all of the body's organs, reproductive system, nervous system, and endocrine system are normal, and no biological pathological alterations have occurred. Let's make a basic analogy. The computer does not have hardware damage, but the operating system or some software has problems, resulting in a crash or poor operation. The organic problem refers to the body's organism, the reproductive system, the nervous system, the endocrine system. It is an organic lesion, much like the computer hardware, which has problems. It requires to do hardware repair or even replacement. For example, in the case of pituitary tumors, sex hormones are abnormally raised or lowered, which seriously affects sexual function. Following the onset of vascular lesions, severe diabetes and hypertension will result in inadequate blood supply, organic impotence, testicular hypoplasia, or testes. It will inflict significant harm to a person. There will be a lack of sexual desire and ability after severe damage. Hyperthyroidism causes a surge in libido, whereas hypothyroidism causes a drop in heart rate, etc. The best way to properly distinguish between functional and organic disorders is to consult a specialist for a physical examination to see if there are other diseases. First, we can perform a quick preliminary diagnostic. Whether the original intercourse time was normal and the premature ejaculation started lately. You might consider going to the hospital to see if there are any organic issues causing the premature ejaculation. If premature ejaculation has been present for a long period, more than a half year, it is most likely due to functional reasons. Organic sexual dysfunction belongs to the scope of clinical medicine and hospital treatment. Functional sexual disorders are psychological in scope and belong to psychobehavioral science and not treatment in traditional formal hospitals. The vast majority of premature ejaculation is functional, a psychological scope on the behavior. I believe many brothers have similar experiences. When we feel that premature ejaculation is serious and has affected our sex life, we all think that premature ejaculation is a disease that needs to be treated inside a hospital. We may be given different treatments when we go to different hospitals. Most early patients and patients with functional impotence go to the hospital for examination. If no organic lesions are found, the condition is referred to as psychological or functional sexual dysfunction, which is outside the purview of medical therapy and belongs to the study of psychology. Premature ejaculation, in the strictest definition, is not an illness in the classic sense. Our bodies are healthy, and we have no organic pathological issues. We consider the problem of rapid ejaculation and habitual ejaculation as a disease that is going in the wrong direction and will not provide an acceptable outcome. To cure functional premature ejaculation, it is required to rectify previous abnormal neural reflexes and re-establish normal sexual physiological reflexes. In layman's terms, it means changing the previous bad ways and habits and re-establishing a good way and good habits that meet sexual needs. In essence, the early formation process involves the establishment of individual sexual reflex patterns. Once the human sexual reflex pattern is established, it is relatively stable. If no targeted adjustments and corrections are made, this response pattern will not change much. This is also why healthy people, especially men who enjoy working out, may have premature ejaculation. The treatment for premature ejaculation is to alter the negative behaviors that led to rapid ejaculation and progressively fix them by adopting the appropriate procedures to redevelop a controlled ejaculation habit. I will explain to you in future chapters the methods to correct premature ejaculation, hoping that you will take fewer detours, waste less time and money, and learn the correct concepts. Knowledge and delay methods. So, that's it for today. Thanks for your support and attention. We'll see you in the next lesson.